breast surgeon is the first person that a breast cancer patient sees. So after a biopsy, or sometimes even before the biopsy, we meet the patients, and then we're the first person to discuss that diagnosis with them.
And one of the best parts of being a breast surgeon is that you get to know all of your patients. So not only do you get to know them at the time of diagnosis and initial treatment, but you're following them for years.
So SSM has been a big champion of breast care, and one of the things that's really nice is that they listen to us as clinicians, tell them what tools or supplies or technology that we need to better care for our patients as new things come about.
The Magseed is a little tiny device similar to the biopsy clips that they place at the times of biopsy. It's about the size of a grain of rice. What we used to use before that was a wire. So this requires that the person come hours before the surgery to transport to a different department in the hospital and go through all of this, and then have a little wire sticking out.
My mom was actually diagnosed with breast cancer, and so she didn't exactly have the best path. If she would have had something like the Magseed available for her, I think she would have been able to relax a little bit more the day of surgery. And I think that people would have been able to reassure her. She was so worried about that wire, that's all she could think about. And I think that this would actually help a lot of patients with their anxiety.
Magtrace is basically a compound. It's a new way of doing an old procedure. We actually use that compound, it's a liquid compound, and inject that into a woman's breast. And that helps us find just the lymph nodes that we want to take.
Previously, many women would complain about the pain of the injection for the sentinel lymph node biopsy. This procedure can actually be performed in the operating room when the patient's asleep. So not only does it eliminate potentially a procedure the day before or the morning of, but it also allows them to not have to feel any of it.
So hidden scar surgery is a technique that we use in breast surgery to remove a patient's breast cancer through an incision that is very discreet. I think in the short term, women are so focused on, I need to get this cancer out, that the scar is not something they think will matter long term. But we do know from looking at studies that it does have an impact on your body image and your self-esteem long term if you have a hidden scar versus a visible scar. At SSM, we have hidden scar surgery certification for all of our breast surgeons, and we try to make it a high priority that we are taking into account what that's going to mean for the patient long term.
So I think having these new technologies and new ways to better care for our patients, we can tell them they have less risk of having to go back to the operating room, less risk of having discomfort with a procedure. These are all things people are scared of, and being able to address those concerns at that very first visit by explaining all these great options, I really think helps them with the whole process.
A health system that is behind you and invests in technology that they have it so that you can do your very best work for the patients that you care so much about.
The current standard has been okay, but we have something better to offer, and if we have something better out there, that's what people should be available to them to get.
We look at patients and see what their stress level is coming through the door and compare that to whenever they're going out the door, and it's night and day. And that is the best part of my job, being able to take someone from the brink of anxiety and nervousness about a new diagnosis and let them feel like they're in control of what happens next.